All right. Hello, everyone. I'm San Francisco Mayor London Breed, and I'm really happy to join you all today. Can we believe that it's been over a year now since we've been living in the new world of the COVID-19 pandemic? And I know that I'm smiling right now, and it has everything to do with the fact that all of what we've done and everything that we've talked about in the past in terms of where we need to get to, we're finally getting there. And so today, as a result of the work from our governor and the state, today is the first official day that those who are over the age of 50 can actually get the vaccine. We've announced before people over the age of 65, emergency workers, restaurant workers, public safety personnel, essential workers, grocery store clerks, muni drivers, and others are still eligible. But we are now adding an additional group to the eligibility pool. And here in San Francisco, our efforts have been really incredible, and Dr. Koufax will talk a little bit more about that. But at least 45% of San Franciscans have received their first dose. And over 62% of those over the age of 65 have received their second dose as well. They're fully vaccinated. This is higher than the national and state average. San Francisco is doing an incredible job with vaccinating people. And some of you probably have seen some of the reports that suggest San Franciscans in general are those who are most likely to want the vaccine. So that's why our efforts have been so successful. And yes, we know it's been challenging with certain communities. And we knew that if we didn't embed equity in our outreach efforts to address this pandemic from day one with testing and resources, but also with the vaccine, then we wouldn't be where we are today. This is why in neighborhoods like the Bayview Hunters Point and Portola and other places where we are seeing high rates of infections, this is why we have set up pop-up and mobile sites and locations in those neighborhoods and have made it easy for people to access vaccines without an appointment, because we knew that was going to be critical to getting those who are a little hesitant about getting the vaccine. It would prevent them from doing it. We knew that especially many of our seniors didn't have access to the internet and may not understand how to use a computer. And it was important to make it easy for them to access the vaccine. And our partnership with people like Annie Chung, who you will hear from in a moment, with the seniors, the large senior population we specifically have in Chinatown, the work that she's done in Chinese Hospital to reach those seniors has really made a significant difference. Meeting people where they are, working with community-based organizations, and putting equity at the forefront of everything we do is why San Francisco has been a leader, not just in the number of case rates and the number of deaths in our very dense city, but a leader on rolling out the vaccine and getting people back to the lives that we know and love. But we're still not there. We expect by this weekend we'll be at 50% of San Franciscans vaccinated, and by mid-May, we expect to be at 80%. So we're moving right along. But we also have to remind ourselves that this is not over. We are still in a pandemic. We still need to be cautious around others, wearing our mask, socially distanced, and following the health guidelines in a way that is going to keep us safe and keep our numbers down. We have about 20 people right now in the hospital, one of the lowest numbers we've experienced since this pandemic. We should be proud of what we've been able to accomplish in this city. And I can't wait until we're at that point where we are able to socialize without masks, where we are able to go back to events. And that time is coming sooner rather than later. Next Friday is opening day, the San Francisco Giants opening day. And although they are limited in the number of people that they will be able to allow in the ballpark, they work with our Department of Public Health to come up with a plan to keep people who are in the ballpark safe as they buy concessions and go to the restrooms and interact with one another. They're limiting the number of people who can come in the ballpark. You have to either have proof of a vaccination or proof that you've been tested within a certain time period. But you know what? That's better than not having opening day allow fans at all. So there will be fans, there will be games. We will see this city start to come alive again, one day at a time, on this beautiful sunny day where the temperature is expected to be over 82 degrees. Let's not get too comfortable, because I know most of us are going to want to go hang out in our parks and enjoy the outdoors on this beautiful day in San Francisco, but we still need to be mindful. We're still in a pandemic, and if we want more days like this, if we want more opportunities to open more things in our city, it still requires each and every one of us to do our part. Now, this Sunday is Easter Sunday, and I don't know about you, but Easter is like one of my favorite holidays, because what it means is that spring is here. And when I was growing up, we got to wear our hats and our new dresses. That's when we got a new outfit. It was Easter Sunday. And so I always look forward to going to church, but more importantly, I look forward to coming together with my family and my community. And this year is going to be a little bit different. So I want to ask you all to be very careful. I know that a lot of you may want to have events and gatherings, and so one of the things that Dr. Koufax will talk about are the guidelines and what we suggest you do in order to safely gather with friends and family, because we don't want you to do what you might have typically done. We want you to do what's safe to do so that we can continue to get out of this pandemic. And with that, I want to introduce Dr. Grant Koufax.
Thank you. Good. Well, hi, everybody, and thank you, Mayor Breed, for your ongoing leadership during this unprecedented time. I'm delighted that today we're able to make vaccines available for all San Franciscans ages 50 and over. With this expansion in eligibility, thousands of San Franciscans will be able to get protection from COVID, begin to safely interact with vaccinated loved ones, contribute to our collective effort to vaccinate the entire city, to achieve herd immunity, and allow us to more safely open our economy. This expansion in eligibility comes as we are very close to reaching the milestone of 50% of our adult population having received at least one dose of the vaccine. And for our residents 65 and over, who we know are most at risk for complications, hospitalizations, and dying from COVID-19, an impressive 82% have received at least one dose, and 62% are now fully vaccinated. As a city overall, we are doing much better at slowing the spread of this virus. At the peak of our surge earlier this year, we were averaging 370 new cases a day. As of last week, that number was down to 33. So I am optimistic for our future, but we also still need to be realistic about where things stand today. By no means are we out of the woods yet, and cases in San Francisco have slowly started to climb again. Now, we're still at a low rate, but just in the last week, we've seen an increase of 20% in our case rate. This is not unexpected. We know as cities reopen, including in San Francisco, cases gradually go up. The virus is again spreading. So we must be vigilant in wearing masks, social distancing, and following the precautions that we know slow the spread. After all, together we have beaten back 3 surges. And I know we do not want to see a significant 4th surge here. We are seeing alarming conditions in other parts of the country. As you know, the CDC director and other healthcare experts are worried. That is why it's so important for us to fully immunize our city. Until we reach that all-important herd immunity, the virus will always have the possibility of surging again. And of course, variants remain a concern. They are here in the Bay Area, and we must remain vigilant. And though the state's expanded eligibility comes as welcome news, and I'm grateful for this, we still don't have enough vaccine supply. Our ability to serve all of those who are eligible depends on that supply, and we don't have enough supply yet. But we are ready to go when those vaccines come. We have the infrastructure in place to vaccinate at least 20,000 San Franciscans a day. We are ready to get those vaccines into arms. We just don't have the vaccine. And if we have sufficient supply to achieve our capacity, we could have over 80% of adults vaccinated with first doses by mid-May. Now, although the state does not currently allow for fully vaccinated individuals to interact indoors with fully vaccinated people from other households without masks, the San Francisco Department of Public Health agrees with the guidance set forth by the CDC around small indoor private social gatherings. Once the state allows it, and we are hopeful the state will follow the CDC guidelines very soon because they are based in evidence and science, and also give people who are fully vaccinated a chance to engage with others in a way we haven't been able to do so for over a year. We will loosen restrictions so that vaccinated individuals can safely interact indoors in small gatherings, unmasked, with members of other households that are also fully vaccinated or otherwise low-risk single households. This is yet another reason to get vaccinated. And I have to also just include a reminder in this that even if you get vaccinated and are fully vaccinated, if you get symptoms or are exposed to somebody with COVID-19, please get tested. Tested remains a key cornerstone to our ability to slow the spread of the virus. These vaccines are excellent and safe, but they aren't perfect. As we expand eligibility to more San Franciscans, our mission is to bring vaccines to those communities most impacted by COVID-19. And therefore, we will continue to prioritize equitable distribution throughout the city. One great example of how we can do this is through our mobile vaccination teams. And tomorrow alone, we will be conducting vaccinations at the Lighthouse for the Blind and at Ping Yuan housing site in Chinatown. Still more teams will be visiting our shelter-in-place hotels to conduct vaccinations there. And I will say, just the other day I was at Next Door Shelter where I have a clinic, and it was amazing to be able to take patients I was seeing right over to the mobile vaccine team, getting vaccine to arms in real time. As we gradually move forward in the opening of our city, we will do so carefully. We will make sure that as we loosen restrictions to support businesses, bring back jobs, and restore the vibrancy of the city, we will do so cautiously and in a measured way to keep people safe and prevent another surge that would force more painful closure. But we are on the right path. We are making great progress. Thank you. Keep the mask on, stay strong, get vaccinated when you're eligible and it's your turn, and let's hope for that vaccine supply to improve. Thank you.
Thank you, Dr. Koufax. And now I want to introduce Annie Chung with Self-Help for the Elderly. Thank you so much for being here today.
Good morning, everyone. Thank you, Mayor Breed, Director Grant Koufax. I'm Annie Chung with Self-Help for the Elderly. Mayor, thank you really for the Department of Public Health and all your teams that are working on the COVID response. We feel really proud to be your community partner. because every time when our community are facing challenges, whether it's with testing or with the vaccines rolled out, we always feel that there's someone at DPH that we can go to and express our needs and concerns. And very quickly, I think Mayor Breed and her team have responded, to our community needs. For example, back in January and February, when we found that vaccines are beginning to be available, none of our seniors and none of the community who don't speak English well could really navigate those sign-up sites. When we expressed the need for bilingual materials, your team almost instantly came out with the bilingual flyers, but yet the sites are all in English, so they still couldn't get the vaccines. So I think that we work closely as a response to the city of how important vaccinations are, and we feel that it's really important that we bring the vaccines to the community versus waiting, for those that are from diverse community who really don't have the internet nor the language capacity to sign up for a vaccine appointment. So really, thank you on behalf of all of our seniors for listening and responding to our needs. We work closely with the All-American Medical Group, the Chinese Hospital, the Nichols Chinese Health Coalition, the YMCA Chinatown campus, and also CCDC, so that as a group, we could go around and do outreach and also education work on how important it is for our community to be vaccinated. When DPH again expanded the qualification, considering SRO residents to qualify to be vaccinated as congregate housing, we were very happy. So as of tomorrow, you will start to see all the Pingyuan residents in public housing, as well as SRO residents in Chinatown will get the chance to be vaccinated very, very soon. We work closely with AAMG doctors who are all bilingual, and they came to every one of our senior centers where the seniors are picking up their daily meals, and right there, the community doctors also give the injections and the vaccinations to our seniors. You could see the big smile on our senior faces, despite that they were worried that they will have some side effects, but because they have their own doctors doing the inoculation, and they are at sites that they are really familiar and comfortable, so that lower the sense of discomfort and fear. So I think that's a good model, Director Koufax, to bring the vaccines to really where the patients and the clients are. And then they get a sense that, the whole city and the whole community is taking care of their needs. So we appreciate the efforts of DPH and all your departments, and Mayor Breed, particularly you and your team. Thank you really so much. We appreciate the efforts that you are opening up the vaccine to people from 50 years and older, but we're still concerned that there's 10 to 20% of seniors that are still not vaccinated. So we'll work closely with your staff to bring the vaccines to the homebound seniors as our next project. It's a labor of love, but from our experience in doing the COVID response work, we're not short of volunteers. I think there are many, many volunteers who are willing to be drivers, volunteers, doctors, and also helpers to bring the vaccines to the thousands of homebound seniors and persons with disabilities. So we'll work closely with you on that project. So thank you very much, Mayor, Director Koufax, and all of you for helping to spread the message, because we need our community to be vaccinated. Thank you.
Thank you again, Annie, for being here with us today, and also the work that you do to take care of so many seniors. And I can't wait until we're able to open again so I can go and visit them and enjoy the food, the entertainment, the festivities. I know it's been so hard, especially for our seniors who are, in some cases, living in isolation without support in some instances. So having self-help for the elderly and other really great organizations, keep that connection with them is so critical. And getting people vaccinated is so important, because I know more than anything they want to come together again. So with that, thank you all for joining us, and at this time we'll take a few questions.
As this eligibility expands today, the reality is people won't get an appointment right away. What do you say to people who might be a bit frustrated trying to navigate the system? And also, Annie made reference to some of the seniors who weren't vaccinated yet. Are you concerned that the people who are eligible before this might have a tougher time now that more people are trying to sign up?
Well, no, I'm not concerned because of the efforts that we talked about as far as equity, because we have mobile sites. We have people who are going to certain neighborhoods where we see high infection rates who are providing the vaccine to people. And so we're taking our lead from community-based organizations, but we did this from the very beginning. That's why over 62% of people over the age of 65 in San Francisco are vaccinated, and over 80% of them have already received their first dose. That's unheard of on a national level. So I'm not concerned about reaching those communities. And keep in mind, there are some people who are saying, well, I don't know if I want to get this. So I don't think we'll ever get to 100%, because there are some people who are hesitant. And that's why I got the vaccine. I wanted people in the Western Addition, where we had a lot of folks who were saying that I'm not going to get the vaccine. I wanted them to see that I got it and that it's safe and that they should get it too. And I know there were a few people, including one of my friend's moms who lived around the corner. She said, well, I'm only coming here because you're here, Mayor, and says you're getting it, I'll go ahead and get it. So that's really where we are and what we're going to do. I'm not concerned. I'm not concerned because the city's efforts and our work and the prioritization for certain zip codes and the places that people can drop in and get the vaccine. But we're going to have more supply on top of that. So it's going to be a lot easier. And it just requires people to be a little bit patient, but we're going to get there. I am smiling more. I think it's for me, I'm still wearing my mask and doing my part and keeping my distance. And I think it's now out of habit, but I'm looking forward to maybe before I probably would have never gone to the Giants opening day. But now I'll probably stop by and check it out a little bit. So I'm a little bit more comfortable, I think, going out in public. But for the most part, I'm hoping that we get more San Franciscans vaccinated so people can all feel a lot freer. Yeah, I just think that it's unfortunate, and it's another distraction from getting our kids back in school. I think, when the grown-ups all of a sudden become the story and become, the distraction in this case and many other things that have sadly happened at the school board, then it takes away from what's most important. And no one person should be more important than protecting and supporting our kids and getting them back in school. I'm not prepared to provide any update as to where we are. I mean, this is a pending lawsuit, so we want to make sure what's appropriate to say and what isn't appropriate to say before we start talking specifically about things that we plan to do. I do know that this is one of the reasons, not necessarily the lawsuit, but the lack of movement by the school district is one of the reasons why we're developing this program Summer Together, because we can't just sit around and wait for them to get their stuff together. We have kids who are struggling right now, and when you think about it, the achievement gap was already problematic and it's gotten worse. And when you think about what's going to happen to these kids if they don't get the kind of education that they deserve to get within the next couple of years, we're going to have some real problems. And so I'm focusing on what we can do rather than what they're not doing. And that is the Summer Together program, where kids will have the ability to participate in a program that will help with the learning loss that they, I'm sure, experienced over the course of this past year during the pandemic. As I said, I am not prepared to talk about that at this time. I want to make sure that I understand the legalities of all of that this entails. It just happened yesterday, so before I make any public statements or comments, I want to make sure that I understand fully what this could mean and what the city can do to participate or be involved in this in any kind of way. It is a lawsuit that is geared towards specific members and the school district, and we know that the school district is its own entity, but we also know that the city stands ready and willing to help and to support our kids in any way we possibly can. And as I said, this is another, unfortunate failure of, a particular individual in this case, as it relates to our children. If you really care about kids, then there are things that you just will do or will not do to impact their lives. And I think it's really unfortunate that we're at this state of affairs. Well, the appetite, you mean of the people once folks are in a better place of being vaccinated? Well, I think that most people are going to want to come together with people that they may have not been able to come together with before, especially those who have elderly parents. I'm hearing a lot about people who had babies and they wanted the babies to meet their grandparents. And so I'm seeing a lot more of that, where people are feeling a lot more comfortable and less afraid of possibly having an impact on someone who is more vulnerable. I think that people are going to want to get together more. I want to go see a play or a concert, or I'll take anything at this point, but I'm going to be more interested in doing things that we haven't been able to do as a result of this pandemic. I'm looking forward to see people singing. Like right now, there's, a prohibition right now on those who can go out and entertainment. There's some limitations here because we are still in this, but we have to proceed with caution, because the last thing I want to do is come to the people of San Francisco and say, yes, we're at 80% first vaccinations of all San Franciscans, but guess what? We're seeing a surge and I have to shut the city down again. Like, that's the last thing I want to do. So I think that we are still going to need to proceed with caution. We're going to have to ride this wave and continue to do our very best. I can't hear you at all. I'm sorry. The advice to find an appointment for the seniors. We're going to be doing a lot of outreach, not just with self-help for the elderly, but we have aging and adult services. A lot of our programs, we've been able to identify seniors in those hardest hit communities through outreach, through the various programs that we fund, and offering, rides to seniors and letting them know about the specific locations and being able to walk with the seniors. And I'll give you an example. So Maxine Hall, which is located where I got my vaccine in the Western Addition, you don't need an appointment for Maxine Hall. And so what's happening with folks who are a part of a number of organizations that serve seniors, like the people at the Senior Service Center where folks go to eat every day, there are people there who offer to walk them or to use the vans to drive them around the corner. If they want to get their vaccine, they're asking them every single day. And there's just a lot of very organic outreach efforts that are happening with a number of agencies that serve senior communities throughout San Francisco. Okay. Anything else?
Are you at a point where, if, this vaccine rates up, where you can commit to San Francisco residents that we won't be rolling back in any of the
I can commit to San Francisco's what?
If you can commit that we won't see a rollback in those.
No, I cannot commit that. All right, thank you.
You should step aside or at least bring in the right consultants or people, which the city has offered on numerous occasions to help support you in your efforts. I'm not an accountant. I don't understand the numbers. I have a whole budget team. I'm not going to get in there and try to fix the budget and change the budget. I just need the people who can help me understand what it is the numbers do and how I need to make the decisions and how this is going to impact the people in San Francisco. And the point is, as an elected official, you don't have to be an expert at everything, but you do need to be capable of bringing in the right people who have the expertise, financial expertise, or long-term strategic planning, or facilitation, organizational. Like, you have to be able to make the right decisions about what happens so that we can move the dial forward and get these kids back in school. Because everybody, there's no doubt, everybody cares about our children. Everybody cares about what's happening. But I think that the actions of what we're seeing play themselves out is just a mess. It's a mess, and it's embarrassing, and it's disgraceful. And we know that this is a school district that doesn't have sufficient resources as is. And so you, as a member of the board, is going to turn around and do something like this. This is an embarrassment. And my hope is that it's one thing to sue in general, but you're going to sue for some money. Like, I just, that is something that a member of the school board who voters elected should never have the ability to do. And my hope is that folks really take a look in the mirror at their role and what they're playing in terms of what's happening with our school district and these kids, their lives and their future. It's on us. It's on us to do a better job at making sure they're back in the classroom, and making sure that educators and students are back in classrooms safely, the janitors and all the other people who are working. And we need to take the politics out of what's happening with our school district.
We really gotta go, guys.
Would you even accept an apology from Collins at this point?
Apology?
If she apologized for her tweets, would that be something that was acceptable?
She doesn't. Why would I be concerned about an apology from her? She didn't do anything